So, hello everybody, and welcome to our Measles 101 live stream. We will get started shortly, so come on into the room. Thank you for joining us. Glad to see you here. I'm Dr. Janina White. All right, welcome everybody. We've got live stream going on Facebook. We're on IG. So again, I see some hand waves. Thank you so much. I'm Dr. Janina White, Deputy Public Health Authority with the Houston Health Department, and so glad you're here again for our live streams. We're kicking these off a series that will keep going as long as we have information to share and you've got questions you want to ask. I will start again. We were saying the measles 101. So let me just go back and remind everybody. I'm sure you've heard it, but I want to say it again that measles is a highly contagious infection that many of us hadn't really seen in a very long time. So for many of us, it's good that we highlight how serious this infection is. Highly contagious. If a person were infected and was around 10 other people and they were unprotected, you could imagine 9 people are going to get the infection. Those are 9 people unprotected out of the 10 could actually get this infection. That's how contagious it is. Anyone who is not protected is at risk of getting measles. And so really the best protection is getting your vaccinations. It's a 2-dose series. And we're just here as the health department to ensuring that you guys know that we have vaccine that you can get access to get. The other thing to think about with measles is it really can be a serious infection. So sometimes people will say, well, how serious? But it really has significant complications, especially in children under the age of 5, those who are immunocompromised, or in pregnant women. One thing I want to go back over is what does the infection look like? So we call it the 3 C's. It's the cough, coryza, or having like a lot of nasal congestion, and the conjunctivitis. And that's just really bad inflammation in your eyes, almost the pink eye appearance, but it looks much worse than just a regular sort of viral or allergic conjunctivitis. These individuals, particularly children, have high fever. And that's something that's so unsettling to see someone that has like 104, 105 temperature. So, that's pretty significant. And you'll also see what we call these white spots or Koplik spots. Usually that's for the provider will be looking at that when you bring your sick child or you're coming into the clinic to be evaluated. But there's this word, it's called Koplik spots. And then lastly, the rash that we have seen maybe many pictures. And if you go to our website, we have samples of what that rash looks like. Starts from head, around the scalp or behind the ears. It works its way from head all the way down to the trunk, torso, and to the extremities. So it's what we say a pathognomonic rash that really is nothing else looks like that really, but that's a measles rash. So important for you to know kind of how to assess and evaluate if you thought you, in fact, or someone you knew had this infection. Let me highlight as I watch comments come in, but again, I want to mention that complications are not to be taken lightly. So common complications include otitis media, so that's really bad ear infection, bronchopneumonia, so that's having a pneumonia. They call laryngotracheal bronchitis, sort of really inflammation from the larynx all the way down into the airway, and diarrhea. And why that's important is because any one of those, while it can be supportive care for treatment for measles, there's actually no treatment. If you can imagine if you're dehydrated, having a lot of diarrhea or a really bad significant ear infections where you are febrile, lethargic, can't keep up with keeping hydration, you find yourself having to be in the hospital because you're going to need that supportive care. You're going to need support for IV fluids. You may need oxygen. certainly we call antipyretics or medications to bring down the fever, and just really support to get you through this bad infection. And so some of these children and patients find themselves, so maybe observation in the hospital, but it's serious enough of being in the intensive care unit. 1 out of every 10 measles cases will develop acute encephalitis, that's inflammation in your brain, and that can result in permanent brain damage. 1 to 3 out of every 1,000 children who become infected with measles will die from the respiratory and neurologic complications. And there's a complication that many of us don't see as rare, but it does occur. And it's a fatal degenerative disease of your central nervous system. And what you'll see is behavioral and intellectual deterioration in your child over time. And then they actually can develop seizures. Let's see, if you had measles in the past, does that make you immune? So someone asked, if you've had measles in the past, does that make me immune to contracting measles? And it should. You should have now mounted antibodies. And that's one of the sort of indicators of who would not necessarily have to be vaccinated. If you have proof of immunity by having had the infection, then you have immunity. So that's a great question. Let me also give you a landscape of what's happening in Texas. I think I don't want to miss that opportunity. And we say West Texas is having the outbreak, but again, we travel everywhere, and we talk about vaccination if you go to out of the country to an area that may have measles. But we have measles and an outbreak in West Texas. So just to give you sort of a high level, the counties that are in the West Texas community that are experiencing this, what we call outbreak, are Cochran. Gaines has been the largest one. Gaines County was the largest county, but the surrounding counties that also are included in the outbreak, according to the state Department of State Health Services, include Cochran, Dallam, so I apologize if I'm not saying that correctly, Dallam, Dawson, Ector, Gaines, Lamar, Lubbock, Lynn County, Martin County, Terry County, and Yoakum. Those counties are making up what is considered the outbreak that we're experiencing in Texas and West Texas. They all together right now have 279 current cases that they have 279 cases. From our last report that we get from the state, and it gets sent to us every Tuesday and every Friday. So last Friday, this number was a little bit lower, and we do expect that the number is going to go higher. So next week when we have this time together, I imagine we won't be saying 279, it'll be a larger number. But this is kind of what we would expect in a community that we recognize did not have herd immunity in their vaccine status for measles, mumps, and rubella. To also give you a perspective, 88 of these cases are in the ages of 0 to 4. 120 of them are ages 5 to 17. 52 cases are over the age of 18. And then there's 19 or so cases that they're still trying to get that accurate data for the ages. And this is important to highlight because that is the outbreak that's happening in West Texas. Here, currently in our community in Houston, we had 2 traveler-associated cases earlier this year. And then you may have heard just more recently, we had an additional traveler-associated case. And that was an individual under the age of 5. So it highlights, when you're traveling, so if you're thinking even going to the West Texas community and you're not protected, vaccines for MMR can start as early as 6 months. So 6 months to 11 months, you can get vaccinated if you're going to go into a community that has an outbreak or measles is a risk. So somebody asked, someone says, public health at work and thanks us. So thank you so much. Hardest working group of individuals, if you did not know. What happens if the ear infection gets really bad? And I thank you for that question. And that's the concern, right? That, it's a supportive care. So it's really pain support. But as you guys may know, with many of us, when we have an ear infection, it's that middle ear, it's just awful. And you just do not feel well. So you're probably not going to be eating and drinking. And you can imagine if you're small, dehydration happens pretty quickly. So you're circling back around these patients, or at least I would say the patients, your loved ones, really trying to get them to keep oral hydration if they can, but you may find yourself having to sort of go to a hospital, and that's never fun. It's really stressful for not only the patient but for families. So we're getting close on time. There is a question about grandparents getting the measles vaccination if they're in their 60s. And that's a great question. I would ask you to reach out and look at our houstonhealth.org website. We have some great information about decisions on particular ages. What's unique about that question is, if your loved, okay, one, if they were born before 1957, there's a thought that we all have immunity if we were born before 1957 because measles was circulating. However, if your grandparents are in healthcare, they really do need to know their vaccine status and their immune status in a way, because they're working in that kind of environment. So it's a little nuanced depending on what year they were, because right after the 1957 having everybody exposed, there was a time when the first MMR vaccine was not live. It was not a live vaccine. If it wasn't live, the recommendation is you should get the live dose. And what's hard is, I'm not sure if your grandparents really have their shot record and we know which version they received. So great question. More of that information is on our website, and we will have a great table that you can give to them and they can take it to their healthcare provider to get additional guidance. So we're at time. I just want to thank you guys again for joining us on Facebook Live, where we want to make sure we have information that's pertinent to you in the community. Look for us back again in about a week.